Good evening. Good evening. It's your boy Jay Taylor, Voices for the Voiceless. Peace and blessings, everybody. Today is Sunday, March the 23rd, 2025. And as the title says, the Affordable Health Care Act. And will we have health care, health insurance when we retire? And I think this was brought to me. Shout out to Brother Muse. He shared a video with me and wanted my take on it. And it was Judge Joe Brown speaking on Obamacare. When we retire, I think that in the direction we were going, I think that our retirement, our Medicaid and Social Security was at jeopardy in the direction we were going. But now that we're kind of back on track with the right policies coming from up top in the White House, I think that we're going to have more Social Security afforded to us eventually. I think it's going to be we're going to be fine when we retire, as long as we keep these policies that the Trump administration is implementing, especially with Doge and the wasteful spending. But I'm gonna play some of this from the Real Dana platform. Obamacare is one of the worst frauds. Unpacking the Truth is the name of the video, and it's Judge Joe Brown kind of breaking it down.
Introduced it in 2003 and repeatedly tried to get it through, but he couldn't until Obama's trust fund invested in it. And now we have Obamacare, which rips us off. You will find that there is a trap in the whole Medicare, Medicaid thing that kicks in when you hit retirement age. If you reach 62, you can't apply for Social Security benefits. You can get them, but they will be much reduced. If you wait till 65, you'll get the full amount that you're entitled to. If you wait till 70, what happens is your Social Security benefits will be substantially greater in terms of the primary benefits. But when it comes to Medicare, what winds up happening is if you don't apply for it when you hit 65 because you have a group insurance plan or you have your own private plan and it is adequate to you, each year you delay past 65 will result in a penalty being assessed against you once you do apply for it. Now, a lot.
So at that point, it's a trap when it comes to Medicare. So you have to apply at 65, even if you work to after that, you have to apply for it to avoid penalties. So that's kind of tripped up I wonder how many people know that, because I didn't know that. So that's good information right there as far as, Medicaid is pretty much you good. But when it comes to Medicare, you got to apply at 65 for your retirement to avoid any penalties.
These group plans will cut you off at 70 or 75 years old. And then you have to go to Medicare, in which case you're hit with a stiff penalty. Now, what happens with this is if you wait until you're 70 years old to apply for your Social Security benefits, you don't get any greater amount after 70, but you get a significantly higher amount if you wait till you're 70. But by
Okay. So if you wait till you're 70, you'll get a significantly greater amount than if you did at 65. Interesting.
And you got 5 years worth of penalties to build you because of Medicare.
There you go with the penalties with Medicare though. So at 65, if you wait to 70, it's like a trick bag. You know what I'm saying? Either way you do it, they gonna penalize you if you apply for it before 65, but if you apply for it at 65 before 70, all of this is like, up under Obamacare, and we just trying to figure out what's the best way to go about it. You know, people coming up on retirement pretty soon. And this is just good information to know. And you get with your, somebody that you could speak with that's in the your healthcare provider beforehand to see what options are available to you as well.
And Medicaid as well. And what that's about is certain people want this huge reservoir of funds to be available to go in and raid for their special programs, their agendas that they have, social agendas, and things that most of us do not approve of. So what winds up happening is, let's say that you had a group insurance plan through your union that you keep through your, say, 70, 75 years old. What winds up happening is maybe you were paying $1,680, $2,130 a year for your group plan. By the time you get through paying the penalties with Medicare, and if you are not in that category of being flat broke busted, but you got a good 401k that's in operation or a good retirement plan you set up, you don't pay the $174 a month for Medicare, which is the primary fee, which, by the way, if you multiply it by 12, is going to be pretty close to what you were paying for your group insurance. But when the penalties attached to it, and if you are not at the very bottom of the income scale, with your increase in the increments of your monthly payments, you might wind up with the now increased co-pays and deductions that you have to take care of, that you secure alternative insurance to get Part B and Part G and Part D. You might wind up, instead of paying $1,800 something a year, $2,100 something a year, you might wind up paying $12,000, $14,000, $16,000 a year for Medicare.
Wow. Yeah, so it's a lot of different trick bags caught in there. So the best thing to do, from my perspective on that, is to go to your healthcare provider upon when you decided to retire and see what your options are, what you have available to you to move, and how to go about it your best option. And from what I'm hearing, it seems that from 65 is the best time to put in for your retirement, even if you decide to continue working or put in for your benefits, Social Security benefits. But if you work until you 63 or 62, you can apply for it. But they got different penalties and all of that. But like I said, it's certain provisions within Obamacare that Trump said that he's going to keep, and there's certain provisions that he said he's going to get rid of. And man, I'm trusting this administration to really do the right thing as far as us concerned, because that is a huge concern. But as we know, we had people through Doge, and pardon the noise, I'm doing some laundry. We had people through Doge that were receiving Social Security benefits that weren't even alive. People that were listed as 150 years old, 200 years old, still receiving benefits. So I think with them finding that out and stopping all that wasteful spending and abuse, these people stealing the taxpayers' dollars, I think we're going to have a lot more money in Social Security for us when we retire, opposed to it running out and all that they try to say is going to happen. I don't believe that. I truly believe that we're going to be, having a lot of extra funding within our Social Security benefits, and it's just it's just a way to do it, you know. And I think the best way, like I said, is to go to your healthcare provider and ask these questions on what's best for you and what direction to go in. But yeah, want to let Judge Joe Brown finish out his thought here, because I learned a few things with this.
And that is just an absolute ripoff of the American public. It should not be allowed. It's criminal, and everybody involved needs to be pluried about it. Now, that's what's going on with Medicare and Medicaid. And some states like Tennessee do not even have Medicaid because their states refuse to accept the payments. And this has been some years ago since this kind of situation developed. They called it, they did not want to promote socialized medicine. But it's a shame because the United States is either number 23 or number 28 in healthcare provided to its citizens in the world. And that is a shame for our country to be that low down the total.
Wow. So America is doing horrible. For us to be the wealthiest nation in the world, for us to be that low on the totem pole, 28th in healthcare. Yeah, so we do need to revise what we're doing because it's not working. And we work hard all our lives. Some of us started working at 15, 16 years old, paying into the system. And to be taken advantage of like that when you get up in age and your government is stealing your money. And now when you retire, you worried about your health care and, you know, your benefits coming to you and getting the most for your money for what you work for. I mean, it's a shame. It's criminal. Like Judge Joe Brown said, for what they've done, stealing money. And what we're finding out in Doge and you know, shout out to Trump and Elon Musk for even uncovering that. And I think that's going to benefit us in the long end, you know, the long run. So it's just crazy, man. But I think we're going to be just fine because what they have done is put a cease to all of that wasteful spending, fraud, and abuse.
Now, we need some change in it, and it's time. Maybe we need Doge to look at it. So,
see, Judge O'Brien said maybe we need those to look at it.
We can cut off the fluff and get rid of the diversion of funds that is going on with Medicare, Medicaid, and such situations, and the effective huge subsidy that the U.S. government is paying to the medical insurance industry.
These insurance industries are fraud, period. We pay for all of this, every month we pay for these insurance agencies, you know, for coverage. And when something actually happens, they don't cover everything or they don't cover anything, you know, and it's like, what's the point of us paying insurance every month and y'all don't cover nothing? So, you know, and it's the same with Obamacare, the Affordable Health Care Act and all of that. You know, one thing I will give Obamacare and the Affordable Health Care Act is this. It did cover a lot of people, you know, that didn't have insurance. That's the good thing. And I think that's part of the things that why they want to keep certain aspects of it. Trump came out on several, even in his first term, said he's going to keep, you know, certain provisions in it because it did do that. It did cover people that did not have any insurance. But outside of that, when you listen to all of this fluff, you know what I'm saying, that, oh, you retire at this age, and they're not telling you that, and then you getting, they shaving off the top of your money when you retire, when you have, you know, what you can apply for your health care. You know, it's dirty, man. You know what I'm saying? Those are the parts that we need to do away with.
Now, I'll say that that's basically my summation of the situation.
Yep. So shout out to Judge Joe Brown. And that's the truth, man. It's just it's unfortunate that, you know, we don't have this these conversations. and really like dive in, because this is going to affect all of us. You know what I'm saying? And at the end of the day, we all want to retire and live comfortably. We deserve to, and we don't deserve to have our government, stealing our money and sitting up here making provisions. If you do this, if you do that at this age, then at the time we gonna do this. It's stupid. And I went back and looked at some of some footage from remember the debates when Donald Trump was debating Kamala Harris, and they brought up the Affordable Health Care Act. And I want to kind of play that video as I'm pulling that up, on my television. Ooh, true. Bless me. I think I'm coming down with a little head cold. I'm in here drinking tea. You know what I'm saying? Cough drops, lemons, and all that good stuff, trying to get ahead of this, But yeah, man, I think like I said, what Doge is doing is not only saving us on the healthcare, it's saving us a lot of other things, because when we have more money, that's not going to frivolous places, we have more money to invest into the American people, including healthcare, including retirement. All that stuff could go back to us instead of sending it to these foreign nations for frivolous reasons. And that's just the gist of it, man. And for this man to be out here, figuring out this this waste, and for them to be, targeting his companies and all this old craziness, man. They spray painting Tesla dealerships with Nazi and all that on there. Man, this man is doing all of us and our children a great service. You know what I'm saying? But see, you got these wolves in sheep's clothing coming out here and running with these dangerous narratives that he's trying to take away all of this.
Long vow to repeal and replace the Affordable Care Act. With long vow to repeal and replace the Affordable Care Act, known as Obamacare. You have failed to accomplish that. You now say you're going to keep Obamacare, quote, unless we can do something much better. Last month, you said, quote, we're working on it. So tonight, 9 years after you first started running, do you have a plan, and can you tell us what it is?
Obamacare was lousy health care. Always.
Now, mind you, this is from 6 months ago, when he debated Kamala Harris. And he's going to be very honest about his plan, as far as he didn't really know exactly what he was going to keep, what he wasn't going to keep, because he was the president at the time and he didn't have access to the information. So he was like, I got concepts of a plan. They gave him a lot of flack for that. But now that we see that 6 months later that he's actually won the election, we see what his plan is. I see it clear as day, what he's doing with Doge, right? So let's run it back a little bit again, get the full concept of the question, and see how he responds.
Have long vowed to repeal and replace the Affordable Care Act, also known as Obamacare. You have failed to accomplish that. You now say you're going to keep Obamacare, quote, unless we can do something much better. Last month, you said, quote, we're working on it. So tonight, 9 years after you first started running, do you have a plan, and can you tell us what it is?
Obamacare was lousy health care. Always was. It's not very good today. And what I said, that if we come up with something, and we are working on things, we're going to do it and we're going to replace it. But remember this, I inherited Obamacare because Democrats wouldn't change it. They wouldn't vote for it. They were unanimous. They wouldn't vote to change it. If they would have done that, we would have had a much better plan than Obamacare. But the Democrats came.
Man, see, now that is very essential that we understand. In his first term, it was a lot of things that he wanted to do that they fought him on tooth and nail. We would have been had a better plan in place, but everything that Trump wanted to do, they fought him. So, you know, at this juncture, it's like just keep it because at least it's coverage. But now that he has the House, the Senate, and the presidency, he has more leeway, you know, to do more changes, to go in, to do what he's doing with those. They like, go ahead. He got the green light. But this first time, and mind you, this is when he was still running. And we're going to hear a little bit of what Kamala Harris had to say. But they would have had better. Now, when you have healthcare act, you know, that goes down to when people retire and how much they can get for healthcare when they retire and things of that nature. So instead of hating and fighting this man on every front, why won't they work with him? That's what I don't understand about the Democrats that's out here, man. The man won. He the president. He gonna be the president for at least the next 4 years. It's over with. So just reach across the aisle and let's work together on behalf of the American people.
They wouldn't vote for it. I had a choice to make when I was president. Do I save it and make it as good as it can be, never going to be great, or do I let it rot? And I felt I had an obligation, even though politically it would have been good to just let it rot and let it go away. I decided, and I told my people, the top people, and they're very good people. I have a lot of good people in that administration. We read about the bad ones. We had some real bad ones too, and so do they. They have really bad ones. The difference is they don't get rid of them. But let me just explain. I had a choice to make. Do I save it and make it as good as it can be, or do I let it rot? And I saved it. I did the right thing, but it's still never going to be great, and it's too expensive for people. And what we will do is we're looking at different plans. If we can come up with a plan that's going to cost our people, our population, less money and be better healthcare than Obamacare, then I would absolutely do it.
Now thank you. Thank you. You know, if we can come up, it's all about it's not about politics at this point. It's about coming up with the best solution for the people. Less, you know, more affordable with less provisions, as we see that has more coverage. You know, it's about coming up with a plan that benefits is in the best interest of the people. If we could develop something that's better, if people work with on this, that's on the left, then we can go, instead of just fighting each other, we can actually fight for the people. And as we listened to Judge Joe Brown earlier in this video, all that goofy stuff going on with if you retire at this age and, oh, we didn't tell you that you're going to be penalized at this age and all those stupid provisions, if we get away with all that and come up with one concise plan for people, hey, if you retire at this age, this is how much you get. If you retire at that age, this is how much you get. And that's just how we got to do it. You know what I'm saying? Instead of sitting up here, you know, basically, you know, putting the people in a trick bag. Oh, I didn't know, and then getting penalized, and you never even know why, you know?
But until then, I'd run it as good as it can be run.
So just a yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now. But if we come up with something, I would only change it if we come up with something that's better and less expensive. And there are concepts and options we have to do that. And
see, he was very honest. You know what I'm saying? I don't have the plan because I don't have it in front of me. I don't have access to all the information to tell you. This before he was president. Now he has all of that information in front of him. He has people shaking down the wasteful spending. He knows exactly how much money is going where and what and how and when. So now we cut that, you know, and then we implement this. And then we could come up and we take these parts out, just like he did with the, you know, the 1965 segregation law or whatever. It's not about bringing back segregation. It's about taking out bits and parts of it that apply to DEI. You know what I'm saying? It's not like we're going to have white and black fountains and bathrooms again and nothing like that. I mean, it's not about that. So you got to go in, and when you have access to the information, you have a better understanding of what your plan would be. So him just being very transparent right there, they gave him a lot of flack for it, and we're going to hear Kamala.
You'll be hearing about it in the not too distant future.
Vice President Harris, in 2017, you supported Bernie Sanders' proposal to do away with private insurance and create a government-run healthcare system. 2 years later, you proposed a plan that included a private insurance option. What is your plan today?
Well, first of all, I absolutely support, and over the last 4 years as vice president, private healthcare options. But what we need to do is maintain and grow the Affordable Care Act. But I'll get to that, Lindsay. I just need to respond to a previous point that the former president has made. I've made very clear my position on fracking. And then this business about taking everyone's guns away. Tim Walz and I are both gun owners. We're not taking anybody's guns away. So stop with the continuous lying about this stuff. As it relates to the Affordable Care Act, understand, just look at the history to know where people stand. When Donald Trump was president, 60 times he tried to get rid of the Affordable Care Act. 60 times. I was a senator at the time when I will never forget the early morning hours when it was up for a vote in the United States.
Now, she just went totally left with that, you know, very disingenuous. Like, he wasn't trying to get rid of healthcare. See, that's the narrative that they trying to paint. Like he said, he was trying to find a way to make it better, but they fought him on every turn. This is 60 times she talked about, 60 times that y'all fought him when he was trying to figure out how to create it better for people when they retire, people to get their health care at a lesser rate, people to get it, you know, with all these goofy positions that Obamacare, if you retire at this, if you do that, you know what I'm saying? So he was trying to reform it, rewire it, you know, but they be running with these like he was trying to take away people's health care. No, he was trying to make it better. You know what I'm saying? But see how the words they play.
Senate. And the late, great John McCain, who you have disparaged as being, you don't like him, you said at the time, because he got caught. He was an American hero. The late, great John McCain, I will never forget that, walked onto the Senate floor and said, no, you don't. No, you don't. No, you don't get rid of the Affordable Care. You have no plan. And what the Affordable Care Act has done is eliminate the ability of insurance companies to deny people with pre-existing conditions. I don't have to tell people watching tonight, you remember what that was like? Remember when an insurance company could deny if a child had asthma, if someone was a cancer survivor, if a grandparent had died? And thankfully, as President, and we over the last 4 years have strengthened the Affordable Care Act. We have allowed for the first time Medicare to negotiate drug prices on behalf of you, the American people. Donald Trump said he was going to allow Medicare to negotiate drug prices. He never did. We did. And now we have capped the cost of insulin at $35 a month. Since I've been vice president, we have capped the cost of prescription medication for seniors at $2,000 a year. And that's
great. That's great. That's one thing, man. I'm not going to take away what somebody did that was good. They did cap it, you know, so, but at the same time, it's too expensive. Even though you stopped it from getting more expensive, why not lower it? You know what I'm saying? Like, you talk about you capped it at a certain point. If you would have done some of the things that Trump has suggested, all of that would have went way lower, way cheaper, more affordable is what we're saying. Thanks for stopping it from going any higher by putting a cap on it, but why not trim the fat and lower it altogether?
when that understanding that the value to this is that access to health care should be a right and not the privilege of those who can afford it. And the plan has to be to strengthen the Affordable Care Act, not get rid of it,
Vice
Pass this
President
poll up
Harris,
in
thank
terms
you.
of where Donald Trump stands on
I
that.
want to move to an issue
Well,
that's important for a
She
lot
made a
of.
mistake. Number one, John McCain fought Obamacare for 10 years. But it wasn't only him. It were all of the Democrats that kept it going. And you know what? We can do much better than Obamacare, much less money. But she won't improve private insurance for people, private medical insurance. That's another thing she doesn't want to get.
President
People
Trump.
are paying privately for insurance that have worked hard and made money, and they want to have private. She wants everybody to be on government insurance where you wait 6 months for an operation that you need immediately.
President Trump, thank you.
Okay. So
Bush guy.
that right there. But yeah, man, like you said, and this is where I'm going to close out on this. I think that we're in the right direction. I know for a fact we are, because if we're going in and we're trimming off the fraud that's being paid out, that's going to open up more funds for us, the American people. And in that, it's going to make sure that we have more available money for us when we retire. So people that's getting ready to retire within the next 6 to 8 years, I think that you're going to see your premiums, grow significantly in your favor. You know what I'm saying? Because now that this money's being freed up and we got some true leadership in the office, if Kamala Harris would have won this election, we would have had more money being wasted on illegal immigration, and we'll be on the brink of World War III. We'll be in World War III, and we'll be having more of our money being distributed and dispersed outside the United States instead of inward. That's why we have to be pro-country. That's why we have to be about here, not standing with other nations, because this is for us. This is when we retire. This is for our children when they work and then they retire. So we have to be pro-American because it's in our best interest. You know what I'm saying? But yeah, it's your boy Jay Taylor, Voices for the Voiceless. I hope that this video, adds some knowledge and wisdom. I learned a few things, but what say you? Leave it in the comment section. Please like, share, and subscribe. Share the videos, man. We're trying to grow and we're trying to put the information out there. Well, thank you for tuning in. Peace and blessings. Until the next time we speak, we'll speak to you soon. All right. Bless.